guys?
Yeah.
Oh, tic-tac-toe is my favorite.
I love it.
What do you guys think about this test coming up? Pharmacology. Man,
Who needs medicine?
I just think they're taking it so easy.
What?
Man, so behind. So bad at tic-tac-toe. I just think they're taking it so easy on us this semester, don't you think?
No, absolutely not.
No, it's just so easy. Class
To you.
Yeah.
EMS Unit 179-217-215-864-9210-210. I need you en route to P. Sherman 42 Wallaby Way, Sydney for unresponsive patient. Be advised, caller states patient is breathing with an unknown downtime. Sydney PD advised scene is not safe due to wild kangaroo herd.
It's 729-467-8725 to base.
Base to EMS Unit 1. Sydney PD advised scene is now safe. Proceed to P. Sherman 42 Wallaby Way, Sydney.
Scene is safe.
I have one patient, he fell, and we don't need any backup, and the scene is safe.
Okay. Hey, ma'am. We're EMS. My name's Samantha, and this is Ashley. What's going on today?
He fell and I can't get him to wake up.
Okay.
I don't know what's going
Did
on.
he hit his head?
He did hit his head.
Ashley, could you take C-spine precautions, please? All right, I'm going to assess his airway. It looks patent. He's not breathing very well. Ashley, do you mind using a BVM to bag him? Thank you. All right, so his breathing rate and quality is going to be okay now. We're going to do skin color and temperature for circulation. His skin color and temperature is clammy, cool. He's diaphoretic. He does have a palpable pulse. We're going to go ahead and load him up and take him to the hospital with us, okay, ma'am?
Yes, ma'am.
Okay. Since we've labeled him a load and go, we're going to do a rapid head-to-toe assessment. Starting at the head, okay, we're going to note some bruising and swelling to the head. We think he maybe has a closed head injury. We're going to check his pupils for if they're round, equal, reactive to light, and they are. Nothing noted in his nose, nothing noted in his ears. Airway is still patent. We're still getting good chest rise and fall. His trachea is midline. JVD, nothing noted. JVD. We are going to size him for an appropriate C-collar. We're going to take the back of his neck. We're going to step. Nothing noted there. Okay. We're going to look, listen, and feel on his chest. We're going to look. There's nothing abnormal noted on his chest. We'll listen to breathing, lung sounds. We're going to do left side, right side, lower left, lower right. Okay, lung sounds are clear. We're going to palpate. No crepidus in the ribs. No subcutaneous emphysema. Chest looks fine. Abdomen, we're going to palpate all 4 quadrants. Patient does not move or nothing noted in the abdomen. Hips, we're going to check for stability, in and down, no crepidus, nothing noted. We're checking the legs for any Decap BTLS, nothing abnormal noted. We're going to check pulse. No motor function, patient is unable to follow commands, and sensory, there is a reflex pulse. Patient's unable to do motor, and sensory, he does have reflexes. Okay, we're going to go ahead at this time and load him onto the long spine board. On your count, head person's count, we're going to roll him onto his side. Keep breathing for him. Okay, 1, 2, 3. Perfect. All right, we're going to check the back. Decap BTLS. Nothing noted on his back. Okay, on head person's count.
1, 2, 3.
Perfect. Okay, if you'll do the straps. Put CIDs on. Perfect. One at a time here. Keep that good. Perfect. Okay. Get the strap down. Perfect. Right across the forehead. That's perfect. Now actually, if we go to the side, still breathing for him, we're going to load him onto the stretcher. We've secured him with 3 straps, still breathing for him. Okay, perfect. Okay, if you'll get the end, the feet, we're going to load him onto the stretcher. Okay, you ready? On the count of 3. 1, 2, 3. Perfect. The straps. We have our patient strapped into the long spine board and the stretcher. We're going to reevaluate pulses, make sure they're still present. Motor still unavailable. Sensory is still present. All right, we have pulses in all extremities. Motor is unavailable due to the fact that he's unconscious. Sensory is present in all extremities. We're going to go ahead and load him up, get him ready to go in the ambulance. Ready? 1, 2, 3.
Was this sudden or gradual?
It was sudden this morning. He said he was going to go take a shower, and 15 minutes later, he wasn't answering me, so I went in there and he was on the ground.
Okay, all right. And when was he last normal? Was he normal when he went to take a shower and he was okay?
Last night he was normal, and this morning he woke up and he said he was feeling a little sick to his stomach, and we didn't have time to eat breakfast. So.
Okay, all right. And so there was no indications that this was going to happen this morning?
No, he's diabetic, so he didn't eat his breakfast, and
Okay,
so
all right.
maybe that's why he was sick in his stomach, I guess.
Does he have any allergies that you know of?
No allergies.
All right. Is he currently on any medications besides insulin?
No,
Okay. All right. And his past medical history, anything besides he's diabetic?
nothing at all.
Well, we're going to go ahead and get him to the hospital, and we're going to take really good care of him while we're there. So we will meet you there.
Okay, thank you so much.
You're welcome.
Okay, first things first, we need a set of vitals. I'm going to take his blood pressure. Turn on the monitor. We're going to take his oxygen percentage as well. Get blood pressure going. Also going to put him on the 12 lead. He's got a pulse, so we're good. Alright. Right arm on the right arm. Right leg on the right leg. Left arm. Left leg. Okay. Now V6 goes on the mid-axillary line. V1. And B4. Okay. We're going to analyze blood pressure. Alright, we got the blood pressure. It was 80/55. Pulse ox is 98%. Good job with the BVM. We've got our 12-lead EKG. I'm going to print a strip and read it. Okay, his strip looks good. It looks like normal sinus rhythm. They've got a P wave, tight QRS, T wave is present, upright. Everything looks good. Pulse is great at 72. Vitals are looking good. We probably need to get an IV started and get him some fluids to get his blood pressure up.
Okay, so I got my tourniquet on. I'm going to go ahead and start my IV. I got an 18 gauge. We're going to grab some blood while we're going ahead and doing this. And I'm palpating for my vein. I'm going to palpate for my vein. Once I find it, I'm going to go ahead and clean my area. Alright, once I've found it, I'm going to insert catheter, flashback, alright, occlude the vein. Gonna grab a syringe and go ahead and get some blood. Alright. Okay. So I'm going to go ahead and hook my fluids up. Okay. Alright, and I'm going to put the solution to keep the vein open and hang it up.
I'm going to check his blood glucose, and it says that it's 47, so I'm going to give him some thiamine. I'm going to clean his port and draw it up 100 milligrams and then inject it and let it loose. Then I'm going to go ahead and give him some dextrose. I'm going to clean his port again, pinch it, and give him some dextrose and release.
His girlfriend found him laying in the bathroom. He had hit his head. They said that he had not eaten that morning and he is a diabetic. His, his blood pressure was 80/55. His pulse was 72. O2 was 98. And AccuCheck was 47. We got an IV started in his left AC with an 18 gauge. Started fluids and gave him 100 milligrams of thiamine and 25 grams of EPA.
All right. Thank you guys so much. I appreciate it.
Thank you.